Hello everyone, welcome to the channel GDC English. In this video, we're gonna have autonomic nervous system ka part, sympathetic system. In this, we will have the synthesis, storage, and destruction of adrenaline, as well as the adrenergic receptors and the pharmacological actions of sympathetic system. Right? So let's get onto it without wasting any time. So sympathetic system, nervous system, is a condition in which you feel like fear like condition or emergency like condition. Whatever goes inside your body, that is involuntary in nature and that is controlled by the ANS. But when it comes to about the fear part, fear conditioning, right? Then only sympathetic nervous system comes into the place. All right. So let's understand what is sympathetic nervous system over here. So for example, you are running. You are running. Normally, you are running. But at the case when a dog comes around you and starts barking to you, as well as starts running towards you, along with his friends also, means that many of the dogs are following you back and running around you. In that case, you will feel like fear, like fight and fear like condition. All right. So at that moment, noradrenaline is the main neurotransmitter at the most of the sites of your synaptic vesicles. All right. Noradrenaline will be your major neurotransmitter. So now let's talk about the synthesis, storage, and destruction of noradrenaline. All right. So now, for example, this is the cytoplasm in which the tyrosine, the circulating tyrosine, comes around the neuronal cytoplasm. Neuronal cytoplasm, that is, tyrosine comes under this. Now, there is a enzyme known as tyrosine hydroxylase. Tyrosine hydroxylase, which converts tyrosine into L-DOPA, that is levodopa. All right. Now, this step, conversion of tyrosine to L-DOPA, is a rate limiting step because it happens very slowly. It occurs very slowly. So, this is a rate limiting step. All right. It is a rate limiting step. That is tyrosine hydroxylase is an enzyme which is used to convert the tyrosine into L-DOPA. All right. Now, this L-DOPA converts into the dopamine. Through which enzyme? Through dopamine decarboxylase, that is dopa decarboxylase. Dopa decarboxylase. Now, this dopamine stores into a storage vesicle, that is dopamine, and converts into converts into noradrenaline. There is an enzyme also. Enzyme is dopamine beta hydroxylase. Dopamine beta hydroxylase. Now this noradrenaline is stored into the vesicles, and we do have this axonal neuronal cytoplasm. All right. Now this noradrenaline will be excrete out, that is excrete and release out through the storage vesicles through exocytosis. Mark my words, through exocytosis, and goes into the synaptic cleft. where it will be acting on the alpha receptor or to the beta receptors or to the beta receptors. So in sympathetic system, we do have only two receptors now. That is alpha receptor as well as the beta receptor. So that's why noradrenaline where comes into the synaptic part that at that time only noradrenaline will act on alpha receptor or into the beta receptor. All right. Now let's talk about the some drugs which inhibits these enzymes also. All right. So if we talk about tyrosine hydrolase is inhibited by me-tyrosine, me-tyrosine, me-tyrosine. Dopa decarboxylase is inhibited by carbidopa, carbidopa, as well as the benzerazide. All right. Dopa beta hydroxylase is inhibited by disulfiram. Disulfiram. All right. These drugs are very much important, guys, because you will have direct questions from here also. All right. Yes. And when these noradrenaline gets into the synaptic cleft through exocytosis, there is a drug that is guanethidine and bretylium. Bretylium inhibits their exocytosis, inhibits their release, exocytosis. Also, there is a drug which which inhibits the storage, that is reserpine over here, inhibits the storage of dopamine into the storage vesicles. All right. Also, whenever the noradrenaline comes into the synapse, there is enzyme which is known as the MAO as well as COMT inhibits these noradrenaline. Particularly, MAO inhibits into the synaptic cleft and COMT inhibits into the axonal cytoplasm, that is neuronal cytoplasm. All right. So this is all about the synthesis, storage, and destruction of noradrenaline. Now let's move on to the receptors part. Receptor part. Very much important, guys. Very much important. All right. So we do have alpha receptors as well as the beta receptors. Now we do have different kinds of alpha as well as the beta receptors. We do have alpha 1 receptor, we do have alpha 2 receptor, beta 1 receptor, beta 2 receptor, beta 3 receptor. See, once you learn the basic mechanism of these receptors, that how they works actually and through which receptor they belongs to, you will get the mechanism of action or pharmacological action very easily. All right. So alpha 1 is a GQ mediated receptor. Alpha 2 is a autoreceptor and considered as the GI receptor, mediated receptor. All of the beta receptor, either beta 1, beta 2, beta 3, considered as GS, that is excitatory in nature. All right. And GI over here and GQ over here. All right. So now you have to learn the locations also. Alpha 1A belongs to prostatic urethra as well as the eye. This eye is very important. Alpha 1 is in the eye. All right. Blood vessels 1B, 1D. That not much important. Okay, but you have to learn this one. Prostatic urethra as well as the eye. These two. Also, if we talk about the alpha 2 receptor, it acts like brake to sympathetic system because it is a presynaptic as well as the autoreceptor. Whenever the receptor is be called as the presynaptic receptor, it will be called as the autoreceptor. All right. And this autoreceptor will be automatically comes into the category of GI mediated receptor. Postsynaptics are also there, which is blood vessels. Blood vessels. All right. Now, if we talk about the beta 1 receptors, beta 1 This belongs to the heart. Belongs to the heart and GG cells, that is just the glomerular cells of the kidney, which releases what? Which releases the renin. Which releases renin. Alright. Beta 2 receptors, all the smooth muscles. Smooth muscle as well as the skeletal muscles comes under these categories, that is bronchus, GIT, bladder, uterus, labor, skeletal muscle, spindle as well as the blood vessels. Now B3 is adipose tissue, coronary vessels as well as the urinary bladder. Alright. Now you can learn this through beta 1, that is we do have one heart and two lungs. One heart and two lungs, that is one heart. One for heart, two for lungs, and all other smooth muscles. All other smooth muscles. Alright. So these receptors are very much important for you guys. And the location of it. Alright. So now let's move on to the pharmacological actions of the sympathetic system. In the heart, there's a positive chronotropic, ionotropic, chromotropic effects are seen due to stimulation of beta 1 receptors. But what is it? What is chronotropic? What is ionotropic? And what is chromotropic? See, chronotropics are the drugs which increase the heart rate. Ionotropic, which increases the contraction. Chromotropic increases the automaticity. That is the conduction. Alright. Conduction through AV node, SA node. Alright. Whenever there is a stimulation of beta 1 receptor, you will see the heart rate increasing, contraction is increasing, and automaticity is increasing. Alright. GIT. Smooth muscles of GIT are relaxed by direct action of beta 2 receptors and indirect action of alpha 2 receptors. Alright. Smooth muscles of GIT are relaxed by direct action of beta 2 receptors and indirect action of alpha 2 receptors. Urinary retention can occur due to relaxation of detrusor by beta 2 action and contraction of trigone sphincter by alpha 1 action. Here, this one is very much important, guys. For example, this is a bladder. Alright. And here we do have the detrusor muscle. And here we do have the sphincter muscle. Alright. Now, when the sphincter relaxes, whenever the sphincter relaxes, the urine will flow out. But in the case of sympathetic condition, what is happening over here? There is a urinary retention. Urinary retention means that this will constrict. The sphincter will be constrict, very much constrict like this. So there will be no flow of urine through it. This will be contract, and this will be relaxed in the case of urination. And something is relaxed, then the flow can be done now. But in the case of sympathetic system, what is happening over here? The detrusor muscle gets relaxed and sphincter muscles gets contract. Alright, sphincter muscle gets contract. So relaxation of detrusor muscle by beta 2 action and contraction of trigone sphincter by alpha 1 action. Alright. Pregnant uterus is relaxed by beta 2 stimulation. Activation of alpha 1 receptor in vas deferens seminal vesicles, and prostate facilitates ejaculation. Ejaculation. That is the release of sperms. Alright. Bronchial asthma muscle contains beta 2 receptor but no sympathetic supply. There is no sympathetic supply because adrenaline does not actually work onto the beta 2 receptor. Noradrenaline is also do not very much work onto the beta 2 receptor. So there is no sympathetic supply, sympathetic endogenous supply. But if we about the exogenous supply, exogenous, for example, salbutamol, terbutaline, these are the beta 2 agonists that can cause the bronchodilation by stimulating beta 2 receptors. Alright, so I stimulation of alpha 1 receptor present on the dilator pupillary muscle causes mydriasis. Mydriasis. So we do have two kind of muscles in the eyes. For example, here if we talk about these circular ones are the circular muscles. Circular muscles. And here we do have the radial muscles. Radial muscles. Circular muscles contain M3 receptor, whereas radial muscles contain alpha 1 receptors. Alright. Now, if there is a stimulation of alpha 1 receptor, since it is a GQ mediated protein, GQ mediated receptor, now it has to be contract. Now, if it is supposed to be contract like this, then this one will follow this hair part in this direction. Yes. So, your pupil size, this is the pupil. The pupil size will be dilated. So, pupil size will be dilated. That's why alpha 1 receptor present on the dilator pupillae muscle causing mydriasis. And whenever there is an increase in size of your pupil, that term is known as the mydriasis. Alright. Ciliary vasodilation stimulation by beta 2 receptor increases the formation of aqueous humor, whereas alpha receptor stimulation decreases the secretion. Beta 2 receptor are found to be increases the formation of aqueous humor, whereas alpha receptor stimulation decreases the secretion of it. That's why beta blockers and alpha agonists are useful in the treatment of glaucoma, just to reduce down the ocular pressure. Alright, so now glands. Secretion of salivary glands becomes thick. That is, secretion of salivary glands becomes thick means it will be slow down. Salivary does not comes under the sympathetic condition. It is comes under the parasympathetic condition, muscarinic condition. Sweating, the only thing that is comes under the sympathetic condition, that is sweating. Sweating is stimulated by sympathetic cholinergic receptor, that is the M3 action. Alright, metabolic effects. Stimulation of beta 3 receptors cause breakdown of triglycerides to free fatty acids. Hyperglycemia is caused by promotion of glycogenolysis and gluconeogenesis on beta 2 stimulation. Alright, there is a hyperglycemia because at the time of sympathetic condition, what your body wants? Your body wants more sugar. That's why it will promote the glycogenolysis, that is the breakdown of glycogen, as well as the gluconeogenesis, that is formation of glucose from fats, proteins, amino acids, whatever it is. That is through beta 2 stimulation. Alright. Other effects, stimulation of beta 1 receptors in the J.G. cells of kidney is responsible for renin release. Beta 1 is also present into the J.G. cells and is responsible for the release of renin. Beta 2 receptor can cause also the tumors. These are the very much important side effect or adverse effect of beta 2 stimulation. Tremors. Alright. So this is all about the theoretical part. Now let's move on to the MCQ part. Which receptor is predominantly present onto the presynaptic nerve terminal and inhibits norepinephrine release? Alpha 1, alpha 2, beta 1, beta 2. What is it? That is one, the alpha 2 receptor. Alpha 2 receptor is generally present into the presynaptic nerve kernel and inhibits the norepinephrine release. Alright. Now, the rate limiting step in catecholamine synthesis is catalyzed by which enzyme? The rate limiting step. I just told you guys, that is dopa decarboxylase, no. Dopamine beta hydroxylase, no. Thyroxine hydroxylase, yes. Thyroxine hydroxylase is a rate limiting step enzyme which is catalyzed to form tyrosine to L-dopa. Alright. So, stimulation of beta 2 receptor in skeletal muscles, vasculature causes. See, yes, one of the thing I also left to tell you guys that uh, the alpha 1 receptor as well as the beta 2 receptor, both the receptors are present onto the blood vessels. But alpha 1 receptor, because of the GQ mediated things, causes the constriction, as well as the beta 2 receptor, which have the GS thing, will cause the dilation. But what if the person is having the non-selective adrenergic agonist? It will act onto the alpha 1 receptor as well as the beta 2 receptor. But what will happen at that time? At that time, it generally depends on the number of receptors. Number of receptors present on that particular area. For example, if we talk about the skeletal muscles, skeletal muscles have more beta 2 receptor, so at that location there will be a vasodilation. At that location, skeletal muscles have beta 2 receptor and will do the vasodilation. But if we talk about the skin part, we do have the alpha 1 receptor more than that, the beta 2 receptor. That will cause the constriction, that is GQ receptor will cause the constriction, that is constriction of blood vessels. Alright. So stimulation of beta 2 receptor in skeletal muscles vasculature causes vasoconstriction, vasodilation, no effect or increased tone. It will cause the vasodilation. Alright. On the eye, sympathetic system stimulation causes. Sympathetic stimulation causes meiosis, no. Mydriasis via alpha 1, yes. Mydriasis because of the constriction of the radial muscles, which will increase the pupil size, and that pupil size term called as the mydriasis. Alright. Which of the following is not a function of sympathetic stimulation? Bronchodilation, increased heart rate, meiosis, or vasoconstriction. Just told you guys that meiosis is not a sympathetic stimulation, it is mydriasis. Whenever you see a lion, your pupil size will be dilated. No, pupil size will be increased. That what is happening around me. The lion is came. Alright. So mydriasis will be the term. Activation of beta 3 receptor mainly causes bronchoconstriction, lipolysis, increased insulin release, or uterine contraction. Lipolysis in adipose tissue. Very much important, guys. Already asked. Alright. Sure. Which receptor is responsible for renin release for juxtaglomerular cells? That is the beta 1 receptors. Not alpha 1, not alpha 2, not beta 2. It is all about the beta 1 receptor. Alright. Next question. Which of the following is the correct sequence of adrenaline biosynthesis? See, till noradrenaline we have understood, but noradrenaline converts into adrenaline in the adrenal medulla. Alright. This adrenaline was synthesized into the synaptic cleft here only. Now it goes into the adrenal medulla to for the formation of the adrenaline. Alright. So what is the correct sequence? Tyrosine, dopamine, dopa, noradrenaline, adrenaline? No. Tyrosine, dopa, dopamine, noradrenaline, adrenaline. Yes, this one is the right option. Tyrosine, noradrenaline, no. Dopamine, dopa, tyrosine. No. So B1 is the right answer. Tyrosine, dopa, dopamine, noradrenaline, and adrenaline. All the enzymes also which comes into this part are also very much important, guys. So this is all about the today's video in which we have discussed the synthesis, storage, and destruction of noradrenaline, sympathetic receptors, as well as the pharmacological actions of it. All right. I hope you like this video and keep grinding yourself. Thank you so much.